I'm Dr. Randy Rudderman, and today I'd like to speak with you about congenital breast asymmetry. Women know that no two breasts are identical, and nearly all women are going to have one breast that's slightly different than the other. But if you've developed significant asymmetry, particularly when you were young or during puberty, in the shape and position, you're not alone. There are up to 1 in 4 women will describe their breasts as being significantly asymmetric. So this is called congenital breast asymmetry and also developmental asymmetry because most of the time the appearance becomes really asymmetric during the puberty and adolescent ages. So breast asymmetry that interferes with your physical health, social discomfort, causes frustration in and out of clothing with sports and in comparison to your peers can significantly impact your life. This can lead to really profound negative effects on your emotional well-being and self-image. Often breast asymmetry in adolescent women is dismissed as simply a cosmetic concern. However, surgery today and the treatment for breast asymmetry can be really dramatically life-changing. So when are you a good candidate for having surgery for breast asymmetry? Most healthy women at the stage where they feel like their breasts are no longer changing, but have developed significant asymmetry, are really candidates for surgery at that time. And typically people will say sometime around age 18 or 19, but there's no hard rule. In fact, in most women, if your breasts have not significantly evened out within 4 years of development, they're probably not going to even out ever during your lifetime. So patients often come in to describe their breast as being asymmetric, where one is too big or the other is too droopy, or both are too droopy and disproportionately look old compared to your chronologic age. Or there's asymmetry in where the breast tissue is positioned, or how the areola and the nipple area look, or where they're positioned on the chest wall. It's also not uncommon for women to come to the office that realize that they had significant asymmetry most of their life and just never had time to have treatment done, or didn't realize that the treatment options carried low risk and such high predictable outcomes long term. So there are patients that will come in that have never had surgery that want to have revision or some type of breast reshaping to have much more symmetric breast, or may have had breast implants in the past that didn't age well and now have even more asymmetry and discomfort, and are presenting really because they want more physical comfort and less emotional distress. Most women will come in and simply say that they just want their breasts to look similar. And this is where the consultation starts. Surgery for this procedure requires not only technical skill, expertise, but artistic ability and certainly compassion with each patient to really understand what their goals are and to make sure that the surgeon's goals match the patient's goals for treatment. Treatment options today are dramatically better and much safer and much more predictable than they have been in the past. So techniques involved today for treating breast asymmetry often do not have to include a breast implant for treatment. And the treatments are significantly low risk, and procedures typically could be done on the end of a week, and where patients that are in school or have desk jobs can return to their pretty normal life within about 4 to 5 days after surgery, and full athletic activity 4 to 5 weeks after surgery as well. The more normal the breast tissue looks after your procedure, the more naturally you're going to age. And that includes whether you have weight gain or weight loss during your lifetime, you go through pregnancies, you have hormonal changes, even leading up to menopause and later. So surgery carries low risk, and if you work hard to find surgeons that have good technical ability, artistic ability, and ability to communicate with you what your issues are and what you can expect for an outcome, you're likely to be a very good candidate and be very happy with an operation that really can be game and life changing for the future.